The following program on PBS 39 is made possible in part by
Dr. David Lutz specializes in non-surgical spine pain intervention. Dr. Lutz works with patients suffering from degenerative herniated or bulging discs, spinal stenosis, and other musculoskeletal conditions. He utilizes various therapies including spine med decompression therapy, spinal injections, and other methods for treating spine pain. David Lutz, MD, is located at the Neurospine and Pain Center on the Lutheran Hospital campus, 436-2416, and on the web at neurospinepain.com.
Hi, I'm Sandy Thompson, your host of Senior Spotlight here on PBS 39. Well, we have a really interesting show tonight, and the topic will affect so many of you. In fact, 85% of the United States population at one time or another has some sort of back or neck pain. So it probably is you or someone in your family, or if you haven't had that yet, chances are you probably will have an issue. So you need to be informed, and we have an expert in that field, Dr. David Lutz, with us here tonight to answer any calls that you might have. Any questions, just give us a call here. We'll put the number up here on the bottom of the screen periodically during the show, 969-2720. If you're out of the immediate vicinity, put a 1-866 in front of that, and it's toll-free for you. Meanwhile, we're going to meet Dr. Lutz here. He's been with me before on Senior Spotlight, but if you happen to miss that show, which was some time ago, a number of months ago,
yes, it was.
We're going to kind of start from the beginning again and acclimate you a little bit about the anatomy and some of the typical back issues that people might address. Now, as a doctor specializing in this area, what sort of back issues do you see the most? What are the most common?
Well, most commonly, Sandy, we often see neck pain and low back pain issues. And these are really, like you mentioned, a significant problem for Americans because, like you mentioned, 85% of people at one point or another will have those problems. I've had it before. I've had neck pain before. I've had low back pain and sciatica before, too. So
that's what I was going to ask.
From personal experience, too.
Me too, the lower back pain. Do people generally seek a solution, or do a lot of people just weather the storm and say, oh, it'll go away? I'm just tired because I was working in the yard, or it hurts because I have a bad mattress.
Well, it can certainly go either way. If someone has some symptoms that, go on beyond a period of time that's acceptable to them, it really is time to seek care from a medical professional.
Why interrupt your life if there's a solution?
Absolutely.
What would be maybe a typical time period from the onset of pain, neck or back pain, before you should seek medical help?
If you're having problems beyond a few weeks, I think it makes a lot of sense to seek medical attention because it's much easier, from my standpoint, to treat someone with new onset symptoms rather than something that's taken a long time to develop and they take months or even years to come and see a specialist like myself.
Can you worsen your condition if you don't seek medical help?
That certainly is possible, especially if there's some type of nerve damage that can cause a lot of havoc for patients.
Yeah. Okay, now let's go back and talk about the anatomy of the spine so that we can, me included, can clearly understand what we're talking about tonight. We also have some pictures, some slides and diagrams that we're going to be showing you periodically here to help you understand what Dr. Lutz is talking about. And first of all, we're going to be looking at a picture of the spine. All right, start to talk to us about the anatomy, Dr. Lutz.
Well, the spine is like a chain of bones, and the purpose of the spine is multifold. First, it allows for upright posture.
Right.
Next, it allows us to bend and twist and move, but also, very importantly, it is able to protect the spinal cord and the nerves.
And obviously, if you aren't getting something fixed that should be, you could be damaging that spinal cord.
That is possible, absolutely. If you would like to pull up number 4, we can show even a closer view. Between the bones, we see the discs, and the discs, as one can see, is right next to that yellow structure of the nerves. So if we have disc problems, that can affect nerves and cause pain in the back and the neck, down the arm, down the leg. And the discs are like a shock absorber. They're like a cushion. And that can be really problematic if there is damage to that region. And I'd like to show.
So let me, Doctor, let's just so that I understand what we're seeing in yellow that kind of weaves in and out here of the spine. That's the nerve.
That is correct.
Okay, and then the round area is the disc. Is the disc like a more pliable or softer?
It is. You can
tissue?
compare it to like a jelly donut almost. And
Okay.
if you move to slide number 5, we can even show a better picture of that. As one can see in the middle, there is that lighter color. That's called the nucleus, and that's more like a jelly substance. And the outside is the annulus, and that's more of a stiffer structure. You can compare it to the casing of a tire, for example. But if there's a problem with that outer layer, if there are cracks or fissures or degeneration, the contents of the inside can bust through it and bulge or protrude, and that can cause a lot of problems as well.
Could it even like leak out if the crack
It can.
is big enough?
Let's move to slide number 9 and we can show a picture of that specifically. As you can see right there at about the 4 o'clock position, part of that annulus weakened, and on the inside that jelly material is pushing out, and that's irritating that spinal nerve, and that can cause a lot of pain. It can cause sciatica in the leg, it can cause weakness, it can cause numbness and tingling, or even loss of sensation.
So discs seem to be what I hear all the time from people. It's a disc situation, and I'll tell you even what number it is or whatever else. In treatment of this, like if you had a fissure or a leakage right there, would you fix that surgically, or is there another way to repair that?
There are multiple ways to treat back problems and disc problems, and it depends on the severity of the problem, of course. First of all, it makes sense to obtain a scan, for example, an MRI of the lumbar spine if someone's having back pain and leg pain, so we can understand anatomically what's going on. Do we have a disc bulge or a protrusion or a blown disc pushing on a nerve? It's important for us to understand what we're treating so we can treat it most effectively. And to answer your question, yes, absolutely, there are some non-surgical conservative treatments that we can be successful with often.
What does a person usually encounter on their first visit to an expert or a doctor in the field?
Well, first of all, you would see the doctor in the office, and it's important for the doctor to obtain a good history, because that's very important for me to understand exactly what happened, the mechanism of the injury, what caused the injury, what type of activity were you doing that led to this? Was it just wear and tear? Was it a car accident? Was it some type of trauma? Was there a fall? So it's important for me to understand what really happened.
What if somebody doesn't know? I mean, they can't recall anything that injured their back. It just started hurting.
And sometimes that is the case. Sometimes there can be micro trauma or wear and tear, and it can just build up over the years, and it can certainly just lead to a tipping point, basically, where someone once didn't have symptoms, but now they do.
Yeah, so you try to take the doctor all the best information you have, and any past records, if you've had x-rays done before and anything that might help you begin to diagnose.
And the next step is for us to do a physical exam. It's important to do a neurological exam to understand if there's any weakness present or any loss of sensation or other problems. So an exam is important. And then looking at the imaging studies are important to correlate the problem with what we see on the picture so we can come up with an effective treatment plan.
Good. Okay, we have Robert on the line tonight who has a question for Dr. David Lutz. Robert, how may we help you? And by the way, thank you for watching Senior Spotlight.
Well, you're very welcome, and thank you for talking to me. I suffer from degenerative disc disease and have for probably 20 years. A couple of years ago, I had a radio frequency done on L2 through 5.
Yes.
However, that wears off, of course, after a year, but now I'm having tremendous problems with my thoracic spine staying in place and causing symptoms such like the twanging of a banjo string going down my arms. Is this something that could be cured with the same radio frequency procedure, or should I be seeking other alternatives? And I must mention, I'm a Social Security recipient on Medicare, so we must look at the economics at the same time.
I understand.
Sounds like Robert is a very informed and educated person about his problem.
Absolutely. First of all, radio frequency lesioning or radiofrequency ablation is a treatment to help spine pain. And that is pain coming from really the joints of the back. And I'd like to refer the audience to another picture here because this really works to answer your question number 6, please. And the joints in the spine can cause pain. Again, we mentioned before, the joints allow for flexibility. It allows us to bend, it allows us to twist, and so forth. And if we have problems with the joints or pain from the joints, we sometimes can burn tiny little hair-like nerves that go into those joints and supply those joints and improve the pain. And that is a treatment that I certainly do and offer at my practice. But as you mentioned, sometimes those little nerves can grow back, and then the pain can come back. So sometimes
they literally grow back.
The small nerves can.
Really?
Not
Okay.
all the nerves do, but some of those tiny little nerves do. So sometimes we do have to repeat that to keep our patients in as little pain as possible. But now if we're dealing with another area, if we're dealing with pain in the thoracic region, if we're dealing with also discomfort going down the arm, we really should look into that further with some imaging because arm symptoms are usually coming or referable from the neck rather than even the thoracic spine.
So are you saying to Robert then that perhaps he has some new issues or things have changed somewhat since his procedure some time ago?
He certainly could, because the procedure he mentioned to me was done in the lower lumbar spine, and now he has symptoms elsewhere. So I think we really should look into that. Yeah, it could be a new issue that we need to look into and understand the pathology, understand what's going on so it can be treated the right way.
All right, you've got your homework here, Robert. You need to call and get an appointment and check out any of these new issues. Thank you so much, Robert. Kenneth is on the phone tonight, and Kenneth, welcome to Senior Spotlight. Dr. Lutz is here to help you. How can he do that?
Thank you so much, Robert. Kenneth is on the phone with me.
Kenneth?
Hello?
Hi, Kenneth. This is Sandy and Dr. Lutz. How can we help you?
I have been to the emergency room probably 10 times this month.
Wow.
I have degenerated disc in my cervix and in my lumbar. After they treat me, I'm fine. 3 to 4 days later, it is so much pain that I'm going through. I can't lift my elbows. Pain shooting down through both my legs. I can't bend over. It's kind of pain like it's just stabbing me where it just makes me cry.
Kenneth, what do they do when you go to the emergency room? What treatment is it that just lasts for a few days? Do you know?
They gave me some kind of muscle relaxer shot, and then they gave me some kind of they gave me a pain shot and a muscle relaxer shot.
Okay. All right. How can you help,
Sure.
Kenneth?
Well, similarly, we have to understand where the problem is. It sounds like some of the treatments you've had were, certainly appropriate in the emergency room to try to break that severe pain, but sometimes we have to do more to get a longer acting, result that the patient wants, that you want to get out of pain for the longer term. Sometimes some things that we consider are shots in the neck or in the lower back. If this pain continues and it just comes back after a week's worth of treatment, it needs to be looked into further to determine if there are other treatments available, whether that could be therapies or chiropractic rehab or shots such as epidural steroid injections or even surgical options. So
Are you saying to Kenneth then that, going to the emergency room 10 times in a month is indicative that he needs to really address this?
It seems like this is a significant problem for him that needs some specialty care.
Okay, all right. Hopefully that will help you, Kenneth. And again, you can call Dr. Lutz, tomorrow maybe and set up an appointment to get some further investigation. You shouldn't have to deal with all that pain. We also have a phone call tonight from Paul. Paul, what is your question for Dr. Lutz?
I have spinal stenosis, and I just wonder what they can do about that.
Okay, could you define? He has spinal stenosis and wants to know what they can do about it. But can you tell us first what, I don't know, what is spinal stenosis?
Well, spinal stenosis or stenosis is narrowing of the spine. There are a lot of different things that can cause narrowing of the spine. For example, if we have bulging discs like we talked about before, that has to bulge into somewhere. So it takes up space. So that can cause stenosis of the central spine where the spinal cord runs up and down. Sometimes there can be stenosis where the little nerve roots come out on the sides of the spine. So that can cause foraminal stenosis of the spine or spinal foraminal stenosis. So otherwise, joints can cause stenosis too, because the joints get larger. Like, for example, as we get older, our joints and our fingers may get larger than they were 20 years ago. That can happen to those facet joints in the lower spine too. So when those problems occur, that all can cause narrowing, and that can pinch nerves and cause pain and problems. So there are plenty of treatments available for spinal stenosis, from non-surgical treatments all the way up the ladder to surgical treatments, depending on the severity. We were going to discuss tonight the spinal decompression program that we have, the SpineMed decompression.
Is that something that might even relate to the stenosis issue?
Yes. That
okay, let's talk about that
as well.
Can you define it for me and talk about treatments?
Sure, absolutely. And what I'll do is have you pull up slide number 1 to show a picture of the SpineMed decompression system that we have at our office. As we mentioned earlier in the show, discs can bulge, protrude. That can cause narrowing. That can cause pinching. That can cause pain. Pain in the neck, pain in the arm, pain in the low back, pain down the leg. If we can do something to unbulge those disc protrusions, draw necessary oxygen, fluids, nutrients, we often help out the matter a lot. And one of the treatments that we have for that is the SpineMed decompression program. If we want to pull up slide number 2 next, we can see that our patient is fully clothed. She will lay on the table, decompression table, and it's very comfortable. In fact, many patients will fall asleep during treatments. We have 20 treatments that we'll typically perform for 1 hour each, whereby the restraints will hold on to the pelvis and hips and gently distract or separate or pull apart the spine a bit to help unbulge those disc protrusions and draw necessary oxygen, fluids, and nutrients like I mentioned. And if we want to move on to slide number 10, we can show another picture of that, of some of the conditions this treats, including the bulging discs and the herniated discs and the disc degeneration, facet syndrome. All of those things together can cause the spinal stenosis, the narrowing, and that can cause the sciatica, radiating pain down the leg, for example. So that's certainly something that is helpful for many patients.
Okay, I'm surely glad that you brought these pictures. That helps visually for us to understand what's going on. You know all this, but we're just the lay people out there, so this is all very new, and if we can understand it visually, we can understand what's happening in our body better.
Yes, absolutely.
Arthur is on the phone tonight. You're getting a lot of phone calls, Dr.
Good.
Lutz.
I'm glad.
You're a popular guy. Well,
Super.
Obviously indicative that, as we talked about before, about 85% of the population has some sort of back issue, so it affects a lot of you, perhaps including you, Arthur. How are you tonight?
Well, I've been down this road before.
Yes.
I'm just curious to know, they do a lot of things with adult stem cell therapy these days to, regenerate, regrow, repair, fix a flat in your disc, so to speak. Anything like that happen on the horizon anytime soon?
Good question.
Yeah,
the future. The future or research is certainly something that you keep up with and perhaps even participate in, Dr. Lutz. Again, what Arthur wants to know is if adult stem cell therapy is anything in the future for back remedies or
Sure,
helping.
hopefully on the horizon in the future. At this point in time, that's not something that's just yet practical that they're doing on a regular day-to-day basis. But there certainly are a lot of researchers out there working on this, as well as some other types of treatments. So we're hopeful that we'll be able to really get some good breakthroughs for those people who continue to struggle despite everything that they've tried. That leads us into another topic tonight, and that is neurostimulation or spinal cord stimulation. There are some treatments and some patients that just continue to struggle despite physical therapy, despite blocks, despite chiropractic rehab, even despite surgery sometimes. And for that finite select group of patients, sometimes another treatment can be helpful.
Is this a new invention or a new treatment?
This has been around for a little while, but there have been some nice breakthroughs and technological advances, and even in the last year.
Okay, this is called spinal cord stimulation, and I know you brought with us some equipment to help demonstrate what that does, and we have some slides as well that can give you an idea. Let's take a look at number 12. That's neurostimulation, and we have that piece of equipment with us here. Dr. Lutz, could you explain how that works and
Absolutely.
what happens in the body as you use this equipment?
Yes. What neurostimulation or spinal cord stimulation is an electrical therapy. And that is where we will deliver some electricity to the spine and the spinal cord. The purpose is to send signals up to the brain to help block those pain signals coming in from below. So it can help reduce the pain in people struggling with spine pain or limb pain. So it's not medication, it's actually electricity, and that can help overlay some areas of pain too, whereby they can feel a more soothing, pleasant, calm, buzzing, tingling sensation to help cut down the pain, often by greater than 50%, and that can make a big difference for
Pretty
people
amazing.
with pain that can be 10 out of 10, or sometimes I'll hear 20 out of 10 sometimes.
You brought with you tonight a piece of this equipment, what you just saw on the slide actually, but let's take a close look at that. And then
Sure.
the cord, what does the cord do?
Sure.
How
Well,
does
we'll
this
talk about
work in the
both.
body?
What is in my hand right here is the lead and the lead wire, and then we have the battery device right here. And what happens is we deliver some of the electrical energy from the battery to the lead right here, and the lead goes in our patient's back. And what is exciting about this type of treatment is, again, this is something that's ultimately all under the surface of the skin.
So it's implanted.
It is an implant, yes. And if we see on the left picture there, we can see that the device, the pacemaker-like battery device, is implanted under the skin, and the lead wires go up into the back. Nobody knows that our patients have this type of device implanted.
You can't see it.
You can't see it, and you also have a remote, and the remote can help program the device so that
you can, in your pocket, you can have this little remote to program how intense you want the therapy,
Absolutely.
or back it off, or turn it off.
all of the above, and it also will have different programs available to cover different areas of pain at different times of the day.
I'm going to look at this again here.
Sure.
Now I notice, I know that there's a battery in here.
Yes.
I would want to know, if you're going to put this in my body, how are you going to replace the battery, or do you ever need to?
Well, sometimes it does need to be replaced depending on the usage, but it can take many years for the batteries to discharge, and the battery replacement is typically just a very brief, short outpatient surgical procedure where they'll just open up the pockets, put a new one in, and then sew it back up, and then we're done.
Back up again.
Absolutely.
Well, so this is sort of like pacemaker?
You can compare it to a pacemaker in terms of the size, in terms of it's a device under the skin, but it also can really help our patients. And what's unique too this year is that one of the manufacturers has come out with one that's completely MRI compatible, so a patient can still have MRIs despite having a device such as this implanted.
Because they'll often ask you, if you're going to get an MRI, if you have any metal in your body. So you're saying the new ones, some of them are fine, compatible with MRIs, no problem. I can, if I have another physical issue and they need to do an MRI, this is not going to interfere.
That is correct.
Okay.
In addition, our patients can take a neurostimulator trial, which is like a test drive for 5 to 7 days in advance. So the
How would you do that? How do you do that?
Sure. Let's pull up slide number 11 tonight, please. What happens is the doctor will place a needle, just like getting an epidural steroid injection, and then I will thread the lead wire up the back, remove the needle, and then hook up the lead wire to an external battery generator. And our patient will go home for a period of 5 to 7 days, and they can pursue some of their normal daily activities.
And they would have the lead in their back, and then this little, what do you call the battery part?
They will have a battery pack. We call it an IPG, but they will have a battery pack
that goes home with them.
That goes home with them. And they also will have a device that can select different programs so they can try it out and see if it makes a difference for their pain.
You know, I know that it's a small percentage of people that may need this, but if they need it, they really need it if nothing else is working.
Oh, absolutely. And I've had patients who I've suggested the option and they decided to wait and think about it over a couple of years, and then once I finally went for it, I've had patient after patient telling me, I wish I would have tried this type of therapy sooner because it's changed my life.
Well, what about pain injections? Can you talk to me about that? I hear a lot of people with back pain talking about getting an injection.
Oh,
Is
absolutely.
that safe? What do you do? What's in the injection?
Sure, great question. And I will do spinal injections as part of my practice to help patients. The purpose of a spinal injection typically is to deliver cortisone or an anti-inflammatory steroid to the back.
Okay.
And the purpose is to bathe and calm some of those very irritated structures.
To help the inflammation go down.
Absolutely, to cut down inflammation, to cut down pain, and then to promote healing. And then the injections also can be helpful to promote rehabilitation, whether that's physical therapy or chiropractic rehab or even the spine med decompression therapy that we talked about earlier. The injections can really help facilitate those types of treatments as well.
Dr. Lutz, you are such a great guest. I mean, you always leave our viewers with a lot of information, new information, and clarify a lot of things, and obviously always get a lot of phone calls. So thank you so much for being here, and
you're so welcome.
I hope you'll come back again and bring more photos. This really does help us understand.
Oh, thanks for inviting me back.
I know that you know all of this, obviously, but it really does help us. Well, I hope that you've gotten some new information that might help one of you at home with some back problems or neck problems. Meanwhile, we're going to leave you on this Wednesday night, hoping that you'll have a great evening. Once again, our thanks to Dr. David Lutz.
The preceding program on PBS 39 was made possible in part by
Dr. David Lutz specializes in non-surgical spine pain intervention. Dr. Lutz works with patients suffering from degenerative herniated or bulging discs, spinal stenosis, and other musculoskeletal conditions. He utilizes various therapies, including spine med decompression therapy, spinal injections, and other methods for treating spine pain. David Lutz, MD, is located at the Neurospine and Pain Center on the Lutheran Hospital campus, 436-2416, and on the web at neurospinepain.com.